Hello everyone, and welcome back to our channel. Today, we'll be delving into the essential aspects of treating heart failure, focusing on both acute decompensated heart failure and long-term management strategies. Let's get started. When it comes to managing acute decompensated heart failure, there are several key interventions to consider. First, if a patient's oxygen saturation, SpO2, falls below 90%, supplemental oxygen is crucial. Additionally, loop diuretics play a pivotal role in relieving congestion and fluid buildup. Nitrates can also be administered to help ease the workload on the heart. Turning our attention to long-term management, we find that specific medications can significantly impact patient outcomes. Angiotensin-converting enzyme inhibitors, ACE inhibitors, or angiotensin II receptor blockers, ARBs, are integral, as they've shown to reduce mortality rates. Beta blockers are another key player, contributing to better patient outcomes. To counteract aldosterone's effects, spironolactone or eplerenone can be employed. Beyond medications, adopting certain lifestyle modifications can make a substantial difference. Limiting salt intake is vital for all heart failure patients, as it helps manage fluid retention and overall cardiovascular health. For patients with systolic dysfunction, ACE inhibitors or ARBs are often recommended. These medications not only lower mortality rates, especially in cases of reduced ejection fraction, but also help regulate the renin-angiotensin-aldosterone system and ADH, which tend to be upregulated in these patients. In instances where ACE inhibitors or ARBs might be contraindicated, such as in patients with renal failure, hydralazine and nitrates can be considered for asymptomatic left ventricular systolic dysfunction. And for acute episodes of congestive heart failure, beta blockers come into play by reducing preload and afterload, ultimately contributing to lowered mortality rates. It's important to remember that while medications like metoprolol, carvedilol, and bisoprolol can lower mortality, spironolactone and eplerenone are particularly valuable for those with more severe disease and reduced ejection fraction. However, it's essential to be aware of potential side effects, including antiandrogen effects like erectile dysfunction and gynecomastia in men, as well as hyperkalemia. Diuretics play a pivotal role in managing fluid overload-related symptoms like pulmonary edema, CHF exacerbations, and lower extremity edema. Loop diuretics are effective for acute relief, but due to nephrogenic adaptations, they're not ideal for long-term use. Thiazide diuretics can be considered as well. Additionally, digoxin, although not improving mortality, can reduce hospitalizations in cases of severe systolic dysfunction. In certain cases, medical devices become essential. An automatic implantable cardioverter/defibrillator, AICD, is indicated for dilated cardiomyopathy patients with an ejection fraction below 35%. For those with severe left ventricular systolic dysfunction and an ejection fraction below 35%, a biventricular pacemaker might be recommended, particularly for cases involving dilated cardiomyopathy or left bundle branch block. And there you have it, a comprehensive overview of the treatment approaches for heart failure. Remember, individual patient circumstances may vary, so always consult with a healthcare professional for tailored guidance. If you found this video informative, don't forget to like and subscribe for more health-related content. Thanks for watching.